So we have a 25-year-old man. He visits his general practitioner, complaining of resting tremor in one hand and has become progressively more noticeable over the last few months. He is found getting dressed in the morning to be particularly difficult due to lack of coordination. And he feels tired all the time and admit he feeling depressed and lonely. He has not worked since leaving college and lived with his parents. Young boy, 25-year man, not working for last so many years. Patient has expressionless face with the paucity of blinking. A fine resting tremor of the left hand is noticed. Examination of the patient's wrist shows rigidity of the movement and flexion of extension. Mental examination shows some slowing of higher mental function. Observing the patient walking shows the left hand not swing to full and left foot mildly scraping the floor. Well, what's the differential diagnosis? If we look into the question, we are getting a 25-year-old gentleman who has many features mimicking like Parkinson. Expressionless face, no movement in the arm on walking, no swing, decreased blinking, rigidity, tremors, etc. are all the features of Parkinson-like feature. But is it possible to add at this age? No way. Idiopathic Parkinson. Idiopathic Parkinson is a disease of the elderly person. To no way it can occur at the age of 25 years. That means there's something else is there. So if you look into the option, which is the best answer, no doubt Wilson disease. Why? Let's learn the basic concept. Wilson disease is a neurodegenerative disease of the copper metabolism. Typically present in childhood or adolescence and rarely present after third decade. Our patient is a 25-year. Okay. The clinical manifestations are hepatic, that means some liver problem will be there, neurological or psychiatric, what together we call as neuropsychiatric features. At time, they say hepatic or neuropsychiatric, two broad headline. In fact, there are three, 1, 2, and 3. Patient who present with fulminant liver failure has a mortality of as high as 70%. Now, let me tell you, patient can come as an acute hepatitis, or it can come as a chronic hepatitis, or even it can come as fulminant liver failure. All these manifestations can be there. And of course, in the patient come with the fulminant, the mortality is as high as 70%. Liver disease is the most common initial manifestation in children. And older children, they come with neuropsychiatric feature. That's why I told you in the previous slide that at times they are broadly classified into hepatic and neuropsychiatric. Now, I told you about what can happen in the liver. Now, what are the CNS feature? It can have Parkinson-like feature, like in our patient, they have Parkinson-like features. It may have other forms of movement disorder. There can be dystonias, particular other face, what we call as rictus is the word we use, is a type of grimacing. Type of movement is so-called rictus. There can be some eye movement problem also. Psychiatric changes include emotional liabilities, personality changes or depression can occur in these patients. In addition, patient should be this young man should be excluded. Any young patient coming with movement disorders should be investigated for Wilson disease. What are the investigations you like to do? Liver biochemistry, okay, serum ceruloplasmin level, (24-hour) urinary copper excretion, slit lamp exam of the eye can give you KF ring. Look into this. This is typically we are getting deposition of copper in the upper and lower. This is the ring, KF ring we are getting. Now you can see better. Look into much better visibility is there. KF ring. Okay. Well, let's look into other option. Erythema induratum, also known as Bayesian disease, is an inflammatory disorder of the subcutaneous fat tissue. And this can occur in a variety of conditions like tuberculosis, in autoimmune condition, inflammatory bowel disease, certain hematological condition it can happen. But this patient presentation doesn't fit into this category. This classical erythema induratum. Well, then we have option B, epidemic pleurodynia. But before I go to the description, what is pleurodynia? Write down the answer in your copy. Well, epidemic pleurodynia is an infection caused by several viruses. Coxsackie B virus is the most common to cause this. This type of infection causes similar type of pain as the pain that comes from the pleura. It's a type of pleura type of pain is there. But in fact, it is the pain come from the muscles, not from the pleura. The pain mimic like pleural pain. Okay, well, pleural pain has associated pleural rub is there. But in this case, there will not be no rub. Now, the other name of this disease is Bonham disease. As I told you, the Coxsackie B virus is the most common cause. Patient has pain, fever, headache, myalgia. And in our case, this doesn't fit into this category. Mentor disease is an acquired gastrointestinal condition most frequently affect middle-aged men. Symptoms include epigastric pain, fatigue, anorexia, weight loss. It doesn't fit into our presentation. Now again, I have a question for you. It leads to what type of gastropathy? Write down the answer. Answer is it leads to type of protein-losing hypertrophic gastropathy. Let me tell you the basic concept. This is the stomach. This is the lining of stomach. Normal lining is there. Okay, now in these patients, what happened? The lining because has got lots of folds. Lots of folds are there. This is so-called hypertrophic gastropathy. Look, the smooth, it has come into various folds like this. I can show you the picture also, lovely picture. You just see like this, not a lining of the cut section of the stomach, but you can see there are so many folds are there. Oh yeah, just see. So many these projections are there. Okay. So this is not the answer. Then we talk about Whipple disease. It's an infectious disease called by Tophilia whippleyi. It can also give rise to neurological symptoms in around 10 to 40% cases. Isolated neurological features are uncommon. Like in our patient, mainly its patient came to us with neurological feature, although his age is 25 years. Okay. And as I mentioned in the description also, in children, it's made of a hepatic presentation, and in the older people, like in our patient, 25 year, it was more of a psychiatric manifestation or Parkinson-like feature, neuropsychiatric. Well, here we can have some neurological problem, but only isolated finding is not common because this usually comes with diarrhea. Of course, there are many other features also. Cognitive impairment is the most common neurological manifestation. Well, something unique about this thing. Oculomasticary myorrhythmia, also called oculofacial skeletal myorrhythmia, are considered pathognomic of this condition. Well, again, I have a question for you. What do you mean by this? Write down the answer. What are these? Which are pathognomic feature? Well, the answer is they are virtually pathognomic condition Rhythmic movement of muscica, muscatory and eye also ocular. Well, the other skeletal muscle synchronized with the pendular nystagmus is always accompanied by supranuclear gaze palsy, something unique. And many patients may not have eye oscillation, but something facial movement, supranuclear gaze palsy are the classical feature that we see in Whipple disease. Well, our patient has altogether different type of manifestation. Tremor and rigidity are seen. These movements are not there in our patient. Golden line to remember, Parkinson-like feature in a young or a child or young age. You should always think and investigate in terms for Wilson disease. Well, I hope you liked the session. Just to inform you, we have following courses for you. Smart Medicine, there are 350 hours of pre-recorded video lecture of whole internal medicine. It includes all super specialty and allied subject, covering A to Z, including basic concept about every topic. Second, we have tests and discussion. There are more than 1,000 questions with discussion of the questions, sample question and discussion you saw in this session. Now, third thing is Medicine Simplified, which is a textbook of medicine. Harrison is the ultimate book to read medicine, but it is too vast. Reading one page of Harrison, you need half an hour. To understand, you need 2 hours, but you need only 2 minutes to forget what was written in that page. Then what is the solution? We have Medicine Simplified. It's a textbook of medicine, but so-called mini Harrison. It's a summary of what you need to read from Harrison. The book is available in Amazon also. Now, these 3 things are more than enough for your MD, DNB medicine and family medicine final exam preparation, NEET SS exam preparation. You don't need to read any other book. These 3 are complete in all the aspects. For more detail, you can contact at this number. It's a mobile as well as WhatsApp. And this is my personal email ID. Anybody want to reach to me, you can contact me at this email ID. Thank you very much.